What is up guys, welcome back to the channel. This is Dr. Hamis Tech, and if you have been following this channel and have seen some of my videos, you'll be wondering why would I want to put a doctor in front of my name, although I just review tech stuff. Am I a douche or something like this? And some of you may have been wondering why am I interested in like some of these books over here about oral pathology. And the truth of the matter is I am an actual doctor, I am an actual dentist, that's my full-time job.
Dr. Price? Stu, you're a dentist. Hey, don't try and get fancy.
But today we are still going to check out some tech stuff, but something more health related and dental related. And I'm going to explain to you guys why I want to do this. So before I go any further, I am going to change my costume over here so you guys would take me more seriously. Alright guys, so we are in my in zone over here, and I have a few products that I want to share with you guys. And the reason why I'm doing this video is because I've just seen a lot of people selling this stuff, buying this stuff. And I've also seen a lot of famous actually promoting this kind of products, and it's a bit worrying for me as a dentist, as a healthcare profession, to see that people can actually buy this stuff so easily from online stores and whatsoever. And some of you may be thinking that yes, because I'm a dentist, I want to charge you extra, I want you to come to my clinic so that I can do fillings for you guys to do your cleaning whatsoever, but that is very far from the truth. We as healthcare professionals are trained to give you the best treatment plans, the best treatments for your health and well-being. So that being said, I want to look at some of these products and then share with you guys what is the dental side of things when it comes to this kind of stuff. So the first one we have here is this Dr. Whitening device over here. So basically I got this from Shopee here in Malaysia, and basically this one helps you to apparently whiten your teeth. So you're gonna look at the product over here. Like I said, I just bought this by myself. So you can see here, it's a Teeth Whitening Light V1 Dr. White free 5 strips. And as you can see here, it's already 1.1k sold and about 200 reviews. And you can see my face here. Like I said, I bought this myself and then I just want to review it. So step 1 over here, to activate your Dr. White Teeth Whitening Light, release the battery cover and take out both of the batteries. You will see a clear plastic disc underneath the first battery. Remove the clear plastic disc and dispose. Now put both of the batteries back into the Dr. White Teeth Whitening Light and it will now be active. The plastic disc ensures that your batteries are brand new and cannot be used. It's pretty cool. I got a new set of batteries over here. It is not USB-C or USB powered, so yeah, you gotta keep in mind you gotta use old batteries for this. Step 2, take a whitening strip and apply it to upper and lower teeth. Step 3, place mini light in the mouth and press the lower power button on the Dr. White Teeth Whitening Light to begin the whitening process. Keep the mouth guard in place. Step 4, leave the light in for about 30 minutes and turn the light off. After 30 minutes, remove the mouth guard and rinse the mouth and the guard with water so it's ready for the next use. Check the new shade using the shade guide. Repeat daily until ideal shade is received. So it says here that's enamel safe, easy to use, remove years of stain, intrinsic whitening, whiten on the surface by enamel. So I'm going to stop you right here. Basically, when it comes to dentistry and about stains, we have intrinsic stains and we have extrinsic stains. And extrinsic stains are usually caused by, red wine, all these saucy foods, tea, coffee, all this stuff that can actually stain your teeth if you don't brush your teeth well and you don't gargle your mouth. Intrinsic stains can be caused by certain ingestion of antibiotics during maybe your mom when she was pregnant with you in the womb and she takes certain antibiotics. It may cause discoloration to your teeth when it does grow out. It could be also caused by certain ingestion of like fluoride toothpaste and whatsoever, and again give you stains from white to yellow to brown to black whatsoever, varying degrees. So going back here, it says that yes, no harmful or toxic substances, safe for oral health and general health, up to 12 months of naturally radiant white smile. So I'm going to check this out here. This is the device, and this is the strip you can have over here. So you can see this one apparently is for the upper, one of it is for the lower. Apparently you just apply it in your mouth and then you activate it light. Of course, I have not tried this yet because I don't want to risk something on my health, on my well-being just for this kind of products, which is not yet really clinically tested. Alright guys, so before we go on any further, I'm just going to explain to you guys what kind of stuff and what we do in terms of bleaching your teeth, whitening your teeth in a proper dental setting like here. So here we have certain products like the Opalescence Mousse, we have Beyond over here. These are very highly concentrated items that only a dental professional will do it for you. This is what we call in-office bleaching. So basically you go see your dentist, they will apply this for you. But like I said, it's very corrosive, so if it does touch your gums, your lips, your hands, your skin or whatsoever, it will cause some certain irritations, some pain, and it also can cause some ulcerations. So these ones are usually, they have a main ingredient here, which is hydrogen peroxide. That is the main one that we usually use. There's also sodium perborate, but this one is the commonly used in most of these brands. This comes in about 35%. And like I said, it's very highly, this is probably the highest concentrated ones you can find in the dental clinic. And some of them are light activated where they shine the blue light on it. Some of them you can just apply it on your teeth and then it will take some time to deactivated and then cause your teeth to get whitened. So most of this will be done about 15 to 30 minutes and then about few cycles, on average about 3 to 4 cycles if it's about 15 minutes depending on which brand you're using. So yes, this one has to be done by a dental professional. Another one that we also do is the home kit. So basically we take a custom mold of your teeth and your mouth, and then basically we let you go home, we give you the kit, you can apply it on the so-called like a mouth guard. It looks like a mouth guard, and you just apply it at home about 15 to 20 minutes, and then you will get some results after about 2 weeks. And then the least one that we don't really recommend, or I don't really recommend, maybe some others will do, is very similar to this, is we give you a so-called stock tray. So you apply the strips on the tray and then you put it inside your mouth and then you just suction it, and then you will apparently just whiten your teeth. Those are not very effective because it's the least concentrated, and it does cause some spotting of the teeth quite frequently. I would say some parts of your teeth will look a bit whiter, certain spots like this, and it's not very evenly matched. The ones that I mentioned you just now, the second one, those are of course less concentrated to the ones we have over here, so that's safer for you and when you use it at home. So over here, we have the Dr. White one over here, and it says that its ingredients has a sodium chloride, hydrogen peroxide, which is the one I told you guys, glycerine, aqua, citric acid, EDTA, cellulose carbon, whatsoever. So yes, it does have the same ingredients as the ones that we use here, but for now I would not recommend using this because there is not much research yet done for this kind of products. That's why it's not yet being sold in a dental clinic. These ones are usually very well-known brands when it comes to dental, when it comes to dentistry. So definitely, you know, even though the dentist may not like this brand, but then they would still tell you that this is still a well-reputable brand because it has gone through years of research, lab research, whatsoever, to make sure that it's safe for you and also safe for us, because you guys won't be complaining to us. Also here, the reason why I say this is because you see over here, when it comes to this kind of products, they'll tell you the manufacturing date, where it's being made, the full list of the concentration of the whitening gel and whatsoever. And it's it's a more of a complete product when you get this kind of stuff compared to you get over here, you just get a box like this. They don't tell you much. So you may be allergic to certain of these products that so it may cause you small problems, and do you really want that? And also another thing is that you have to consult your dentist first before you go to do all this, even when it comes to this kind of stuff, because the whitening is not for everyone, I would say. Sometimes you may have very sensitive teeth that may not be suitable for you, and you may have certain other treatment to be done. You may have some cavity, some decay happening, your gum has a lot of inflammation, a lot of swelling. So it may not be recommended for you to straight away go on to this and then whiten your teeth without going through the full list of treatment necessary for you guys. So another product that we have here is very similar. It's called White Light. As you can see here, I also purchased this on Shopee. So it's very similar. Again, you just put it in your mouth apparently, and then it will whiten your teeth. They have the products all the way inside over here. It says here it's clinically tested, maybe in US, because it's made in US, right? So maybe there it's recommended. They do have the carbamide peroxide, the main ingredient at once. It also consists of the hydrogen peroxide. It's another sort of form they are in. So apparently here they just apply it on the gel and then you apply it in your teeth. I would not recommend this. Look at this, it's plastic, it's so cheap. It may have the same materials, the same ingredients, but then again, they don't tell you the concentration, they don't tell you the full list. So I would not recommend this as a dental professional. Of course, again, in certain countries, maybe where you're from, you can consult a dentist regarding this. And last one we have here is this Sonic Pick. This is a portable scaler that you can purchase yourself. This also comes about, this kind of stuff comes about 20 ringgit, so it's about 4 or 5 USD, super cheap. So first of all, when it comes to this kind of stuff, this is a scaler, what we do to remove your stains, your whitened teeth, healthier gums. Yeah, this is what we do over here as well. I wouldn't recommend this because first of all, do you even know how to brush your teeth properly? Do you even see your dentist every 6 months? Because if you don't even know how to brush your teeth, are you sure you want to put this sharp device here in your mouth? You may have some old fillings, some crowns, some bridges, some other treatments have been done in your mouth. And if you use this, it may cause some problems with it. Your fillings might get loose, you may cause more damage to your gums if you do it too aggressively. So yeah, I wouldn't really recommend those kind of stuff. Just get a dentist or dental hygienist, depending on where you're from. Get their advice to see if these are all recommended. They have like so-called this aqua pick kind of thing here to clean your teeth in between your teeth over here. We do have this kind of products that is being sold in a dental clinic, dental setting. But then again, this one's, I'm not sure how reliable it is, and I do not want to try it because I only have one set of teeth and I do not want to damage it. So yeah, be careful about buying all this stuff. So that is it. This is Dr. Hummer's Tech. If you did like and enjoy this video, do click the like and subscribe button down below. I do a lot of tech videos on mainly phones and whatever so on. But if you guys want more videos like this where we talk about health issues, we talk about dental issues, do leave a comment down below and I will check it out. Some of you may be interested in those kind of toothpaste where they have charcoal toothbrush and all that. If you guys are interested, I will do a separate video on it and talk about it further. If you guys have some other medical related questions, don't worry. As a dentist, as a doctor, I can give you my advice.
Take a look, I'm actually a doctor. Yeah, you said that several times last night, but really you're just a dentist.
But if you don't want my advice, of course, I can call my medical colleagues and they will help you out with those. So also do follow me on my socials as well on Twitter, Instagram, Facebook, and here on YouTube at Dr. Hummer's Tech. So that is it. Stay safe, take care, and of course, wash those hands.